Hello and welcome to today's episode of The Untold. I'm your host Abdullah Al-Hindiani, and for today's episode we have physical therapist, sport medicine specialist, and chiropractic Yousef AlSaleh. If you've ever broken a bone, if you ever had a ligament kind of tear, if you ever felt any kind of pain in any of your joints, today's episode is the episode for you because Yousef is going to share with us all about the knowledge in health, lifestyle, basically how to get better once you're breaking something in your body. With that, stay tuned. We'll come right after the break. And we're back with Yousef AlSaleh, and I do want to welcome you on the show because I'm very excited for this episode.
Thank you. I'm excited to be here. Thank you for having me.
Thank you. And the reason I say I'm excited for this episode is because I don't know if it's a sign of old age, because I like to think that I'm fairly young, but now every time I try to move, I hear like the gears clicking, right?
Yeah, of
I
course.
hear the engines like,
Yeah.
where's the oil?
Well, age is nothing but a number. But let's
Yeah.
be realistic. Honestly, it's as we're growing older. As much as I'm getting gray hair on my beard, also our joints are aging. This is a
Yeah.
part of life. In all honesty, this is realism.
Yeah.
So in this aspect, I always tell my clients, first of all, being a physical therapist in sports medicine, chiropractor, when somebody tends to train, when somebody hears you start feeling those certain types of pains in your body, the best way to combat that is to actually start working out and start living a healthier lifestyle.
Yeah.
I'll give you an example. For a office worker, let's say, who has a desk job, 6 hours a day. He's hunched over, he's working on his computer, his shoulders are rounded, so he's really living not a good posture, especially for me as a physical therapist. I'm trying to correct his posture.
Yeah.
So and he or she is doing that for 6 hours, let's say. The best thing that I can tell you is that to combat that 6 hours and to fix everything that we actually kind of destroyed throughout the day is to go to the gym at night.
Right. Yeah.
So when you do start going to the gym and you start lifting, I always recommend lifting because I feel that's the backbone of the body. When you start lifting and increasing your muscle mass, you're going to protect your joints. You're actually going to feed your joints. Your muscles are going to give you this protective mechanism and you're going to become stronger. So, when somebody does go to the gym and they start lifting or doing a certain type of exercise, you're actually doing physical therapy without really needing me. You're doing physical therapy to yourself. You're fixing what you destroyed throughout the day, let's say in your office, sitting in a weird posture, and you're fixing that posture that we do need, that really good, strong stance.
Yeah.
Yeah.
Yeah, I think you highlighted a very key kind of tidbit of information there because I read somewhere that us as humans, we're not supposed to be like our bodies are not supposed to be sitting as long as we are sitting in today's age.
Yeah, because we've got 300 joints in our body and over 600 muscles.
Yeah.
And 206 bones. Is it 200? Yes, it's 206 bones. We have three little ones in the ear. And so all of this, as human beings, we're meant to move. We're locomotives, so we are meant to move. Our body is meant to be moving. So my job comes in once you start inhibiting that movement. Once you start going to the gym and you can't do a specific exercise or the pain is not letting you actually move. So that's when I come in. And going back to training or certain exercises, if you're going to start lifting, I highly recommend for especially men and women to start lifting weights. This is the difference between a person who's going to be 70 years old and requires assistance waking up or getting up, and somebody who's 70 years old and doesn't require any assistance, because we get to start from now until the rest of our lives, inshallah. So you're going to start building those muscles, and your muscles have something called a muscle memory. And you know this. So that muscle memory tends to kick in, especially in our old age. And I get to see it with my clients, especially the way of thinking now. Health and physical therapy and moving and working out is not what it used to be, I would say 20 years ago.
Right.
There's more of a paradigm shift, especially now in Kuwait. It's become a trend, like people do go to the gym. And it's really nice when I go to the gym and I see these 14-year-olds, 15-year-olds trying to live a healthy lifestyle. They're trying to start moving again. And so when I see that, I'm like, yeah, when I was 14 or 15, I didn't have it was for the older generation. It wasn't for my generation. But no, I think now there's a really nice paradigm shift, especially with social media, and people are talking more about health and how you can increase your muscle mass. So it's a really good way of leading the pack.
Yeah. So I am very happy that you brought in that women should also lift weights, because I know a lot of the female members of our family, you know, especially the older ones, I keep telling them, you know, go lift weights. All they say is that we fear that we're gonna be muscled.
So
Yeah,
yes,
it's not gonna happen.
you have to understand something. You have to make that. Well, you know this, but girls who lift weights, I've been lifting weights for years.
Yeah,
I'm still didn't reach the muscular physique that I want to reach.
yeah.
You know,
That
you
that's
understand?
what I
Yeah.
tell them. Right?
And
Yeah,
we have the main thing that differentiates males from females is that we have a high level of testosterone.
yeah,
And so our testosterone goes into the muscle, and that's how we build muscles. So when it comes to women, women tend to lift weights and they get to grow muscles, but they're not going to become muscular.
yeah,
They're not going to become muscular. And actually, this type of beauty standard now has changed throughout the years, because before we used to look at somebody who's very skinny and model-esque and we say, oh wow, this is the example that we want to go to. Now it's actually more of a fit,
right.
athletic
Yeah,
build that
yeah,
people want. But there's also certain exercises that are catered for women more than men. Let's say Pilates. Pilates, you get to use your body mass.
yeah.
So women, I would always recommend my clients, especially girls, I'm like, no, go do some Pilates, go
Body.
to do some strong yoga, go do some Zumba, go do some body exercises. If anything, use your body as a means of lifting weights. So you get to do just air squats, push-ups, pull-ups, core exercises, and
Right.
these you don't even need
Yeah.
you don't even need weights. You can do this by yourself.
And honestly, you know, yoga, because when I was studying in the United States, I used to take yoga classes.
Yeah.
They are way harder than any weightlifting exercise you
Yes.
can do.
Yes,
You know,
I tried to do yoga and I got really bored very quick. Actually, yeah. So
Yeah.
for me, and it's more than one exercise that is
Right, yeah.
catered to you. So what I do as in terms of weightlifting might not be the best for you. You
Right,
like to
yeah.
do your basketball, your paddle. That's fine. You can do that too.
Right.
But I found it more relaxing for me to go join a boxing class than it
Yeah.
is for me to join a yoga class.
Yeah.
But again, you have to pick and choose. It's all trial and error. Yeah.
But yeah, the idea is to keep moving, right? Because stagnation
Exactly.
is the enemy of health.
Exactly.
Yeah.
Exactly.
And I do want to ask you something about that, because we've been talking about fitness this entire first minute, and I do want to ask about what brought you into this line of work, right? What kind of sparked that fitness curiosity within you?
Absolutely, that's a great question. Ever since, here being in Kuwait society, as soon as we're born, they get to plan your life for you. So as soon as I was born, all I can remember is like, oh, this is our little doctor. This is our doctor.
Yeah.
So I always had an idea that I'm gonna go into medicine. Surprisingly, I was going to go into dentistry. I wanted to be a dentist,
Yeah.
but I broke my hand, and that hand break really turned my whole perspective about medicine upside down, because I had to go do physical therapy on my hand.
Yeah.
And so when I applied, I studied here in Kuwait University, and when I applied, they were like, no, you can't apply now because it was the middle of the course,
Oh.
and in dentistry you have to start at the beginning of the year. So I went into University of College of Science, and they're like, yeah, by the end of the year you can transfer all your grades, and then we'll accept you into dentistry. And so throughout the time, I was like, I really enjoyed that whole process of physical therapy, especially with my arm, with my broken arm. So I started reading about it, and then I was thinking, this is kind of new for Kuwait. It still is considered a rare profession.
Yeah.
So I was thinking, okay, maybe I should go into that. And at that time, I was around 17 or 18 years old. This is when I started working out, and this is when I started going to the gym again. So I started applying what I did in my lifestyle, and I started applying it to my professional career. And this is why I went to physical therapy.
Yeah. And honestly, you did mention that we have 200 something bones,
206, yeah.
which is, mind blowing, because if you ask the average Joe, which is me and a lot of people, we only think of bones as like these, it's like, well, we have a dozen of them. But to think that we have over 200
You have
kind of
over
bones.
206,
Yeah.
and we have to know the names of all of them in our field.
Yeah.
And again, over 300 joints, over 600 muscles. So these are all meant to move,
Right.
And as a physical therapist, I always tell my clients, I'll help you in two factors, especially if there's something wrong with your muscular system. I'll help you with your muscle pain. I'll help you with your joint pain. Other than that, when it comes to nerves and broken bones, that's more rehab. That's more of a specialized orthopedic doctor.
Yeah.
But I would always go for joints and muscles. And, with muscles, we give them strengthening exercises, rehab exercises, pain management, electrotherapy, dry needling.
Yeah.
And with joints, we actually do, which is what I am as an osteopath and a chiropractor. And this is the kind of techniques that I do for joint issues.
Yeah. And you did mention there something that is a little bit of new to me, dry needling.
Dry needling,
What is
yeah,
that?
it's actually a form of pain management modality. So I'm sure you've known of the acupuncture needle.
Occupy, yeah.
So this is more traditional medicine.
Okay.
When we're talking about dry needling, we're talking about modern medicine. It's an amazing breakthrough in medicine. Honestly, it's a pain management tool. You get to target directly the nerve root of the injury,
Oh,
the nerve root of the
yeah.
muscle, and it's a little painful. But I always tell my clients, what we reach today in 2 sessions, we could have saved 5 sessions in the future.
Oh,
So
okay.
what we would use 5 sessions in pain management, we would really get rid of it in 2 minutes. And
Yeah.
the whole science behind it is amazing. But at the end of the day, it's a needle inserting into the muscle, getting rid of that trigger point, and then
Oh, okay.
managing the pain.
But is there a reason why it's called dry needling? Because I don't know what acupuncture is, and
Yes.
I
Well,
yeah.
acupuncture, and for lack of better words, is just it targets the pressure points in the body. It's
Oh,
more
okay.
of a relaxing technique. It does
Oh,
pain management,
yeah.
and it's really good. So
Yeah.
dry needling came after. So it's a building block from acupuncture.
Oh, okay. So it's
And
the next step of it.
exactly. And
Okay.
dry needling, the needle itself, why is it called dry needling? There's no medication in the needle. The needle
Oh.
itself is dry.
Oh,
The
okay.
needle itself is the actual medication,
Yeah.
is the actual therapy. So the needle itself, when you enter and you give that little muscle a kick,
Yeah.
that's dry needling. So you actually insert the needle dry with no lubrication, with no medicine or anything.
You did mention the little kick, and that is something that always fascinated me because I broke this leg in half, right? And then I had a metal plate,
Yeah.
and then I had to go through physical therapy. But the thing that kind of surprised me throughout all of this is when the doctor kicks you or something with the
He
hammer,
give you that
and then your leg kicks.
it's
I was
called,
like,
yeah,
how
that
are you
reflex,
doing
that knee reflex,
this?
so
Yeah.
we have some involuntary reflexes in our muscles and
Yeah.
voluntary reflexes. So this is an involuntary reflex here that you
Yeah.
can't control. If I give you that little hammer kick,
Yeah, honestly, just
that's a nice way to check if your knee is working. Yeah, yeah,
thankfully my
yeah,
knees work.
yeah.
Yeah. And speaking of knees working, what are the most type of injuries that people come to you to talk about, right?
Well, it's a range, but it's becoming very repetitive now, especially being in the field. Like if I'm going to talk about rehabilitative injuries, it's always associated with ACL tears. And you know why? That's because
Football?
the main governing
Yeah.
sports here in
Well,
Kuwait is football.
I just mentioned my leg.
You
It
got it
broke from playing
from
football.
football,
Yeah.
exactly. So I've seen tons of cases like that. And then we're talking about pain management. It's usually the rotator cuff, because we're using the phone all the time and we're bending forward,
Oh,
and
yeah.
we're very dependent on artificial air. So our muscles, especially with this hot weather, you go out, you go in, our muscles tend to relax or contract. So usually it's related to low back, neck pain. But the most injuries I see are ACL injuries, reconstructive ACL injuries, which ACL stands for anterior cruciate ligament.
Okay.
And so it's a reconstructive injury, or pain management when it comes to muscle tightness.
Honestly, you mentioned two areas where I did go for physical therapy in it: the knee and the rotator cuff.
Yeah.
So I don't know what they call the rotator cuff in Arabic, because when I was studying the
Lafaf.
Lafaf,
Yeah.
because when I was studying in the United States, that's when I first knew about this whole thing, the exercises.
Yeah.
And now every time I'm looking at my friends, they describe their pain. I'm like, that's the rotator cuff.
That's a rotator.
And I give them these exercises like this, and then you go like this, and
It does work.
It works like
it really
magic.
does work, because you're focusing a certain exercise, or you're catering a certain exercise to a specific movement or a specific pain. So we have to understand, okay, so if you come to me to the clinic and you're like, physio doctor, I have an issue here, and I'm like, okay, with which movement? So these muscles are different from these muscles. The muscles that move your hand this way are different from the muscles that move your hand away from your body. And so you're like, oh no, it's fine here. It's just with this movement, with the movement where I have to go pick up a glass. Like, okay, so then there's a light bulb. I'm like, okay, so it's certain types of muscles. And then I'm like, okay, so is it when you overstretch, or when you start moving and then you tell me? It's actually fine when I'm working out. So when that means when your body's heated, when your body's hot, it's fine. But so it's when you cool down, that's the issue. So it's certain things or certain clues that lead me to a certain injury.
Yeah.
So it's like a map that we have, a mental map.
Yeah. And I'm very glad you stopped on that point, because we are going on a break, but I do want to go back to this one, especially on your procedures and working with clients.
Yeah.
But before that, we are going to take a very quick break. We'll come right back. And we're back. We are still joined by Yousef AlSaleh. And before the break, I did put you on the spot in talking about your procedures with clients.
Mhm.
So let's say I'm a new client, I just walked into your office. How does that whole process goes?
Absolutely. So there's two ways of looking at it. If I'm going to talk about, because I work as a government job in the morning and then I have a clinic at night.
Yeah.
So most of the clients that come to the clinic, they come because they have a pain management issue. So that means that they're doing everything. They're really doing everything. It's just certain pain is limiting them from, let's say, exercising or sleeping properly.
Yeah.
And then you have the other type of patient, which has it's post-surgical, and then he needs a full rehab session. So if you're a patient who has a full rehab session, I would look at the surgery site and have you first come in for an assessment and see where you are on the pain scale and where you are on the muscle scale and the range of motion.
Oh, okay.
So if you, بعيد الشر, God forbid, if you come in and you have like an ACL injury, I would ask you, how long did you do the surgery?
Yeah.
Hey, you tell me. A month. And I say, okay, you're still in the first phase. So we have an ACL protocol that we follow. It's a worldwide protocol, by the way. So when we talk about ACL injuries or knee injuries, there's a certain protocol that is done for clients, for patients. So it's not, I don't really bring it from my head.
Yeah.
It's a certain point system that we go through. And then most of the time we start with a little bit of electrotherapy to actually give the pain, to manage the pain in the knee. And then within the first or second week, we start giving the patient exercises that are functional for him
Yeah.
and his injury. So that's with ACL injuries. And ACL injuries tend to take a long time, 4 to 6 months, especially with athletes. Athletes, they want to get back to their sport as quickly as possible. So we tell them to be patient. And it's nice because they get to see the advances and they get to see themselves become better from session to session. So that's rehab. But if we're going to talk about pain management and the clients that come in for the pain management, the number one thing we have to do is an assessment, first of all. So you would sit down, we'd have a little bit of a chat, 5 to 10 minutes talking, and I would just want to pinpoint, like, are you taking any specific medication? How you got that injury? How did you sustain your injury? What would you do to make the pain less?
Yeah.
What movements make the pain more or aggravate the pain? And so then we'd start doing a full body chiropractic session.
Okay.
So I'm sure you've seen the videos. I like to start with the neck down, which is the spine. And so with chiropractic techniques, or as they call osteopathic techniques, the main thing we do is that we relax the nervous system. And by relaxing the nervous system, everything else relaxes. So you're hitting the nail on the head with that one.
Yeah.
So we crack the neck. So the cracking itself is basically a little bit of air bubbles of synovial fluid, they say, because what lubricates the joints is something called a synovial fluid.
Okay.
And so when the joint goes, when the fluid itself goes through the joint, it creates like a little bubble or a pressure bubble.
Is this, and I don't mean to interrupt you, but just to make it clear, is this like the same thing that when you're clicking your fingers?
Absolutely.
Oh, okay.
Absolutely.
Right.
So yeah, you did that, and then you feel instant relief. That's
Yeah.
because there's a pressure buildup in your joints.
Yeah.
And as we mentioned, the body has a lot of joints, and so this pressure buildups tend to really limit your full range of movement, especially for the nervous system. So we get to relax it. I start with the neck and I do my maneuvers left and right, and then I go down to the rib cage, I go down to the shoulders, lower back, middle back, knees, ankles, and then everything tends to crack. And you get to see the client really comes in really, they're really relaxed. And after that, we get to focus on the main injury area. So let's say if somebody has low back pain, I'd give them a little bit of electrotherapy or heat therapy, and then I always finish with dry needling. That's my go-to. That's my signature. I always finish with
dessert of the final procedure.
That's the cherry on top. The dry needling. It really does give you that jump from being I'm in pain to I barely feel anything. And something that I'm very proud to say about myself is I really care about quality over quantity. So it's not really how many patients I see, it's did I deliver the required treatment properly. And so all my clients have my personal number, all of them. It's because after 3 days, I would always want feedback. So if they don't send it to me, I would actually send it. I'm like, so Abdullah, how do you feel after the session? You'd be like, oh doc, I feel amazing. The pain went away. I'm like, okay. So I would probably see you a month from now. Here's some exercises you can do, and then if you want to see me again, just let me know. This is how I would end a session. And I always tell my clients 3 days. Always give yourself 3 days. So I had one client the other day. She came in and I cracked her neck because she was a office worker, and she had a desk job. And so as soon as she left, within an hour, she's like, I feel amazing. I said, okay, yeah, I'm glad. I'm glad you feel great.
Yeah.
But wait for 3 days. And then she texted me 3 days later. She's like, I couldn't wait. I'm like, yeah. So how do you feel after 3 days? So she sent me 3 days later. She's like, yeah, I feel great. And then same procedure. I gave her exercises to do, and I should be seeing her in September.
Oh,
Yeah.
I mean, hopefully she's feeling even better by then.
So I always like to do 2 sessions, especially for pain management. One session is now, and then the second one, if everything is fine, a month later. And that's just because I want to see, does your lifestyle affect your injury? Does your habits, like daily habits, you're sitting a lot, does it make the injury come back? So that month is like a trial period. And so within the second session, honestly, 80% of the time, the clients come back and they say, yeah, the pain was gone. If it came back like just within 10% out of 100.
Yeah.
And so that second session, you would eliminate the pain, and you would remind the body that this is your posture now. This is what we want from you now.
Yeah.
Because the body always tends to go back to what it was. Always tends to defy you from the pain. It's very stubborn.
It's a part of change.
Yeah, it's very stubborn. So it's like the body's is going to tell you, why did you crack my neck? It was fine. So it would always want to go back to pre-therapy.
Yeah.
So then we have to remind it again that no, this is the new norm. This is the new normal for you.
Yeah.
And one more point before we go to the next question. I always get, should I crack my neck at home? Should I let somebody crack my neck? I'm like, first of all, if you're going to let anybody crack your neck, it should be a professional. So don't go to a barber. No barbers cracking the neck. No spas. Yeah. I mean, it's happened. It's really happened. I've had clients come in like this with their neck crooked. They're like, oh, I had the barber cracked my neck. So go to a professional. There are, not just me, there are a lot of professionals who can do it. Something else is that you're allowed to crack your neck, but I'll tell you what, you're allowed to do this.
You're talking about these kind of...
So you're allowed to do this. This is fine. If your neck cracks when you're doing this is fine. Just don't look for it. Don't force the crack. Yeah, this is my message to the viewers. Don't try to force anything.
Yeah. I mean, that's basically what a lot of people in the gym do, and myself included. We're always trying to get that little bit of a crack.
If you're used to it and you have certain range and you can do that, and there's a little bit. But no, I've seen people really try to get that crack. So just let a professional handle it.
And speaking of your role as a professional, talking to so many people, and this is maybe going to put the clients on the spot. Can you tell when a client is basically lying about their healing process? Oh, doctor, I've been doing everything you've told me, but I'm still...
Yes. Yeah. It's always... Honestly, I've never had an issue, I'll be honest with you, because it's a friendly talk, and there's no judgment there. So a lot of the clients tend to tell me, we started doing what you told us not to do, or we didn't stick to the exercises. And I tell them, yeah, you're back because you didn't listen to me. And they're like, yeah, I know, it's my fault. Most of the time, if not 100% of the time, I haven't had any issues. But I've had one case where the client was clearly fine. There was nothing wrong with him. But he came in because he wanted to... And so when we first came in, and he didn't want to go to school the next day, his mom brought him in, and it was a big situation. So he was saying that he couldn't sleep because he had neck pain, especially on the right side. I was like, are you sure it's on the right side? He's like, yeah, it's very painful. And so when he came in, I started testing the left side. And he's like, oh yeah, it's very painful, it hurts. And I'm like, so I thought it was the right side. And so his mom was there, but I didn't. I told him. He said, and he told me, he's like, honestly, I just didn't want to go to school, and I wanted to come. Yeah, you can tell these things. So that was a funny story. But other than that, no, it hasn't been an issue.
And honestly, the only reason I ask you this is because I was one of the culprits of this. I just mentioned that I did break my leg, and then I went through physical therapy, and the physician, and this is maybe 15 years ago or something, Meskin, he gave me so many lists of exercises, and then I went home, all I did was lie down and watch movies.
I mean, that's on you. I always tell my clients, I give you guys 40%, the rest is on you. 60%
I would say maybe 80 or 90% of the client.
It is. And so now there's a lot of studies that came out that said the surgery is basically useless if you don't do physical therapy after. This is facts now. This is very factual, and all good surgeons are going to emphasize this point. The surgery is going to be useless unless you do physical therapy
because
after.
it's an equation of balance.
End of point. End of sentence.
And I think that's the end of my point, is that when I got back to the doctor, I was like, doctor, I've been doing this and that. And then he tried to close my leg to a certain angle. He's like, no, you're lying. And I was like, okay, yeah. And that did affect my healing process. That's where the end point of that, because I still can't close my leg fully. That just because I was lying back then.
You couldn't flex it. You couldn't flex it.
So the message is, don't lie to your doctors.
Because we'll catch you.
Because,
and also it's funny also because you have the complete opposite also. You have the clients who come in and they've been sticking with the exercise and they've been sticking with the program and they're so dedicated. But then I tell them, don't play football. And they're like, no, but I feel fine. I'm like, no, don't play football. Just trust me. And then they play football. And then they come back with a retrograde effect. All the pain came back, all the swelling came back. So you do have these two kinds of clients, but to be honest, I'm grateful for everything that comes in. I mean, I always tell them, I'm here to help you guys. So just help me help you. And then together we can go on this physical journey together.
And that's an unfortunate reality for a lot of people who like to play football. I mean, myself included, I broke 3 bones, one here, one there, one here, all from football.
The best athletes in the world have injuries. This is a given. If you're going to start exercising, you're going to get injured. You're going to get injured.
Especially with older age.
But I would rather have, let's say, a muscle pain related injury than heart disease, stroke, diabetes. This is what I tell my clients. They're like, oh, so why are we playing exercise if we get injuries? I'm like, yeah, you're going to get injuries. This is expected. But even now when I'm talking to you, I've got back pain because I did deadlifts yesterday, but this is part we're building for the future. But if you're going to go into a healthy lifestyle and fitness journey, this is going to really get rid of everything. Basically, this is like the ABCs of healthy lifestyle. You're going to sleep properly, your hormones are going to be in balance, you're not going to have diabetes, you're going to start having less stress. All the benefits for the body, all the physiological benefits of the body, you're going to get. So that's why I always push for.
And I think something you brought up is also something that changed my mentality and my approach to lifting and everything, is that you are actively breaking the body when you're working out. But you only get stronger after it. So,
no pain, no gain, as they say. So how do muscle fibers grow? You get to break them up and then build them up back again. So it's breaking them up and then building them back up, breaking and building. And so that's how muscle fibers grow.
And unfortunately, because we have run out of time, I do want to leave you with one last question, is that if you could get a message out to people, hopefully to avoid going through, a lot of dangerous kind of rehabilitations, what kind of message do you have for them?
Well, there's a lot, honestly, but I'm going to focus on one today, which is living a healthy lifestyle. There's no age. There's no such thing as, oh, I'm old, so I'll just sit there and not do anything. So you can start having, or too young, you can start, if people have family or kids, start getting them into exercising from 5 years old, 6 years old, 7 years old. What's the problem with that? Or have them educated on it. And the same thing goes to somebody who's in their 40s or 50s. There's no such thing as, I'm too old, I'm not going to do this anymore. So health has no age. It's better to have somebody who is big in size and goes to the gym than somebody who's skinny and staying at home. So this is the benefits of somebody who's actually big and going to the gym are going to outweigh the person who's sitting down and not doing anything.
And I think that's a beautifully put message to end the conversation on. So I do want to thank you again, Yousef Saleh, for joining us.
Absolutely.
And again, one more time, thank you a lot.
Thank you so much for having me.
Thank you. Unfortunately, that was all the time we've had for the conversation segment of The Untold. Stay tuned until after the break. With that, we've reached the end of today's episode of The Untold. That was Yousef Saleh with us. He was kind enough to share all about lifestyle and health, and hopefully you can avoid life-altering injuries. With that, I hope you had a great time on today's episode of The Untold, and until next time, goodbye for now.